I'm Hayley Ryan. I'm a board chair of Wounds Australia, and Wounds Australia is the peak body in Australia for everything to do with wound management. They support consumers, but also those working in the field that are looking at wounds. I also operate my own business, Wound Rescue. It's a national company. We go across Australia and New Zealand. We have staff in every state, and we provide anything from referral pathways, both in-person, on-site and telehealth services, to also education and training. And we can also come on site and support you with, are you meeting the current standards to practice? A long time ago, as a young 19-year-old first starting off as a nurse, my grandmother actually was diagnosed with dementia. With that dementia, she also had some quite severe vascular ulcers on her lower legs. And I had the experience of watching her bounce from one GP to another GP to hospital, and then eventually land in an aged care home. I took it upon myself to work with the clinicians and look at better ways to actually manage the wound. And that was quite successful, because at one point they were talking about amputation, which was quite frightening, particularly at her older life. I guess I grew a passion about wound management and healing lives, not just wounds, by my grandmother and then seeing the patients that I worked with throughout my career. So it's been a long journey, 22 years, but over that time and focusing on wounds, the result you can see in saving lives and preventing wounds from happening in the first place is so gratifying to me. I've been working as a nurse for 22 years now, but probably quite heavily for 18 years in wound management. It first started in theatres and ICU, where I found a love and passion to really making sure that those that had a wound post-surgery were healing in a timely time frame. From that, I have been working across peak bodies such as Wounds Australia to support their cause, and also working in acute sectors and with my own business, Wound Rescue. There are multiple issues when it comes to wound management. One is access. How do you know who a specialist in wound management is? We can't always rely on generalist clinicians or doctors. We need further support, and realistically, wound management is a specialty in its own right. There's also an educational piece. We don't provide enough education in terms of wound management in our universities, both universities and a TAFE course. So therefore, we're sending people out to manage these very complex wounds. One of the issues I would say too is that it's not recognised as a health priority. And that's the reform we really need to work towards. We look at the heart as an organ, we look at the lungs as an organ, and we know that you can go into hospital for cardiac issues, respiratory issues. But what about the skin? That's also an organ. What about looking at that as something that we need to protect? So the quicker we can make it a health priority, the more lives we can save. The 11-point plan is a document that sets out reform and advocacy for what we are hoping to achieve to support clinicians and doctors and surgeons and anyone else dealing with wounds to treat them better at a faster pace, at the right time, by the right person. The 11-point plan's been received very well from Parliament. We've had multiple discussions with both at a federal level and state level about our 11-point plan. It is positive in a number of ways. Firstly, we are aiming to look at developing a national framework, a strategy that looks at how can we better manage wounds for every person, whether they are a child or an elderly person. Everybody living with a wound needs some sort of a process or governance structure to manage those wounds. The other area that it looks at that we're really advocating for, that is a dressing subsidy scheme. So similar to the NDSS with diabetics, how do we get products available to the people that need it most? And of course, the other area is education. And we appeared at the Royal Commission into Aged Care in the Northern Territory hearings, and we provided our testimony. And education was paramount, as was addressing subsidy scheme. So there's some of the highlights. There are 11 points to this plan, so there's a lot more to it, but they're the majority of the highlights that we're focusing on at this very moment. We exist to not only treat wounds, but prevent them from happening in the first place. And the only way to really do that is to get communities involved. So how we communicate this not only to our parliament and federal and state levels, but is also to the community, whether that be within schools, whether that be with, we see a lot of mid-age people who actually have stopped working or quit working because they have wounds that they can't manage whilst they're at work. So how do we provide them that level of education and training to know of what signs to look for? One of the things we do at Wounds Australia is our Wound Awareness Week, and that happens every August of every year. During that time, we advocate strongly, not only to the community, but also to consumers to look for the signs of a wound that's getting worse, such as redness, heat, swelling, pain, and refer early to your local GP or to a wound specialist to get treatment. So the more we can spread the message about awareness and prevention, the better we'll be. There's multiple opportunities for further education and training. One of the things that come to mind is the university, Monash University, that provide a master's in wound management and a postgrad in wound management. Anyone aspiring to further go into that field, that would be a great start. But also connecting with Wounds Australia. Wounds Australia offers multitudes of online training, in-person training in every single state. They would be an excellent resource to not only become a member so that you can stay abreast of all of the latest information and evidence-based details, but also connect with their education. Wound Rescue, my company, we also provide in every state education and training, and we do it not only hands-on, but also on the job. How can we come and work alongside you and support you during your normal everyday practice? Because sometimes that's the missing key. Rather than just the theory and just the presentations, how can we work alongside you? So there's multiple ways to get informed information, grow capacity, and ultimately make it sustainable. There are a number of things that we could be doing to get this as a priority. The first priority must be recognising wound care as a specialist in its own right. The quicker we can do that, the more specialists we'll have available, and they are out there. The other thing we need to do is recognise wounds as a health priority. If we do that, we reduce people dying from wounds prematurely. We reduce the amount of amputations that happen every year, particularly to diabetic population. Also, access. Rural and remote communities is a great example. Those, our First Nations people, how do we get support and resources to them to make sure they are getting the same care that they deserve?